How long have you been working here, Sarah?
I've worked here about 6.5 years.
6.5 years. So practically you and I started here in this surgery center
We did.
almost together.
Yes.
So, and you have seen almost every single patient of mine, almost, that
Yes.
I have done OLLIF.
Yep.
We were talking about after open old-fashioned surgery, only about 4 to 5% of the patient ambulate within the first 48 hours, meaning 2 days after the surgery. And you just told me that you don't have to say the name of the hospital, but you have taken care of those patients in the hospital. Tell me, what was your experience?
Patients were in extreme pain after. They weren't getting out of bed for several days, oftentimes on PCA pumps, and it was always a challenge to get them going. So
Yeah.
much different than an OLLIF patient.
Yeah, well, you and I, we have been doing here all of this here for almost 6 years now, 6.5 years. And you have been taking care of all of them. And you just told me only one patient have ever stayed over the night for 23 hours, but that was a special circumstance. Tell me about it.
Yeah, that patient did very well. Her pain was under control, but she didn't have good support at home to help take care of her after surgery. So she stayed overnight so we could give her a little additional support for that first
I
24
think you can say that the husband was an amputee and had hooks as an arm, and that wasn't able to really taking care of her accordingly. And so, and that was a special circumstance.
Right.
The husband with the hook as an arm that prevented us to send the patient same day home. Otherwise, we are sending those patients home almost every time same day.
Yes.
Now, you have taken care of many of them. Just describe our first patient from today. How was your care for the first case?
So the patient woke up. He had traveled a long distance. He had some pain, but he was up and moving within that first hour of coming out of surgery.
And he came all the way from Canada here to get his surgery done.
Yes.
And was he happy at the end?
Yes. His pain was about a 6, but he was up moving. The pain he came in with was gone. It was all surgical pain.
So the leg pain was gone.
Leg pain was gone.
And he said he's going to send all his friends to us now.
Yes.
Well,
very happy.
Thank you for your care. I think he's going to be also very happy with your care. Then we did a 3-level fusion.
Yes.
So tell me, how did that patient do?
He had some pain as well afterwards, but he got up, I would say, within that first hour and a half.
So after 3-level fusion, 3 cage, 8 screws, patient walked within an hour.
Yes.
Okay. And that by itself is on the spine side is a magic.
Yeah.
That something like that doesn't exist.
Yeah. And he went home about 3.5 hours after surgery.
After the 3-level fusion. Yeah. Well, thank you, sir. So you have seen the many cases here in this complex spine and so on. I'm sure you noticed that this patient wake up at first, they are painful.
Yes.
And what do you think? I'm going to answer that question for you, but what do you think they are painful at first? Let me tell you that, okay? So because it's sometimes hard to understand, and I think all the nurses taking care of this kind of patient, they need to know that. I'm sure when you went to the nursing school, you guys talked about grade 1, grade 2, grade 3, grade 4 burn, right?
Yep.
Now, did you know that the grade 3 and grade 4 burn, where the entire skin is gone and you look at the bone, is painless? Did you know that?
I did.
Yeah. The most painful burn is grade 1, where the apparatus that we feel the pain is still there. In an open surgery, you know that we use bipolar coagulation. We cook the tissue. We kill all the tissue.
Right.
That tissue has no pain initially, but then it takes them months, years to recover. Whereas our patient, we just push the nerves to the side, push the muscle to the side, but they're all alive. When they wake up, if you are not prepared, which we are, otherwise we couldn't get the pain under control and discharge them within an hour. We can control the pain, and then they can go. And but the idea here is that the tissue is alive. So meaning that if you're not prepared, if you don't, before when they wake up, give them Toradol or other medication, they can wake up in severe pain because the entire apparatus that feels the pain is still intact. So I'm sure you have noticed that our first patient woke up and said pain was 500, I think he said, right? But within an hour, that pain was gone because we are prepared with and that is what we need to understand. As well, I think something that all the nurses need to understand, there are nerves we have to push to the side. And mostly the L5S1, and this is as well a video for nurses that take care of this patient to understand that. we have to push the nerve to the side. There's 15% risk of nerve being irritated. So it is nothing unusual, even if they didn't have it before the surgery, if they have especially L5 nerve root, which is top of the foot, to be numb, and the dorsal flexors, tibialis anterior, can be as well weak, but that has a fantastic prognosis. It always gets better. So this is something that as well, I'm sure sometimes you have noticed that you have some numbness in the feet and so on.
Not very often, but once in a while.
Once in a while, yeah. 15% is the risk. Excellent.
Yeah.
Well, from your side, what do you think? What the other nurses that would be taking care of this patient, what do you think? What they should know about these cases?
What I like to tell the new nurses I'm training in is all of these OLLIF patients kind of follow a trend. They do come out in pain. Sometimes it's severe, but within that hour, if you give them their pain meds, they turn the corner.
Yeah.
And sometimes you get to the point where you think, geez, are they going to turn the corner? But they always do.
They always
get
do.
them up and move. Stretching is good. Getting out of the bed.
Yeah.
But
and they all walk within hours.
yes.
Yeah. Now, I think sometimes when we bring people to show them that, they are amazed by the time we go home, patient goes home, and other surgeons, for them, for a spine surgeon, that is like magic.
Yes.
What combination of medication are you using post-op for this patient?
Typically fentanyl is what we give first, fentanyl and Dilaudid, but we like to get the orals on board as soon as they're able to eat and drink. So
yeah, orals. Orals keep them steady.
Right.
And fentanyl has a short acting time, but then you control it. If there's trouble, you just wait 5 minutes, you'll be fine.
Right.
Generally, I like more, something more like long acting. And in the hospital, where I check the BMP and the kidney function, as well, I use Tordol, which works very well. Have you ever used Tordol here before?
Sometimes anesthesia will give that before the patient comes out, but it does work well.
Yeah, it does work well. Well, and I think getting out of bed as well, that itself as well helps.
Yeah.
Anything else you want a new nurse that's taking care of this patient? No?
I think that's it. Just OLLIF is a much different experience than your traditional lumbar fusion, and patients do great.
Well, fantastic. Thank you so much, Sarah.